Alright, I'm going to be performing a physical assessment on my patient today. First thing I'm going to do is wash my hands because hand hygiene prevents the spread of infection. And I'm going to introduce myself. Hi, I'm Pam. I'm a registered nurse. I'm going to be doing a physical assessment today, Mr. Goldner.
Okay, you can just call me Brian.
Great. We are in a private setting and everything that you say is confidential. Do you have any questions about anything?
No.
Okay, great. Your vital signs look great, Brian. Your heart rate was 72 and regular, which is normal. Your blood pressure is 116/76, which is also within normal limits. Temperature was 98.2 Fahrenheit today, and your respiratory rate was 14. Those are all within normal limits. Do you have any questions about any of those?
No.
Great. So we take a look at your skin. Overall, do you have any wounds or lesions at this time?
No.
Do you have any tattoos on your body?
One on my right arm.
Okay, great. So the first thing I'm going to look at is your head. Okay.
Okay.
Okay, can you close your eyes and then tell me where I'm touching you on your face?
Okay. Left cheek. Forehead. Right cheek. Forehead again. Chin.
Okay, I'm going to push against your eyelids and I want you to try to resist me open. Okay, great. So he's normal cephalic. The scalp is pink. There are no lesions. His hair is brown with some gray. It's evenly distributed and straight. Hair is dry with no parasites present. His face is uniformly pink. There are no lesions. His facial features are all symmetric. The cranial nerve 5, the trigeminal nerve, is intact, as evidenced by me being able to touch his face with eyes closed, and he can tell me where I touch. Also, he's able to clench his teeth. Can you show me that?
Mm-hmm.
Great. The cranial nerve 7, the facial nerve, is intact, as evidenced by symmetrical facial expressions, and he's able to resist me opening his eyelids. I'm going to take a look at your nails next. Great. So nails are all pink and convex shaped. They're trimmed and clean. There's no clubbing present, and cap refill is less than 3 seconds long. I'm going to take a look at your eyes next. I'm going to shine a light in your eye, okay?
Mm-hmm.
Can you follow my finger? Okay, and continue to follow. Okay, great. I'm going to have you look at the wall behind us, and then my pen light, and the wall again. Okay, I'm going to have you cover one eye at a time, and we have a Snellen eye chart here on the wall. I'm going to have you cover that eye and then tell me the last line that you can read.
Okay. D, G, A, C, N, H.
Okay, is that right?
D, G, A, C, N, H.
Okay, great. Thank you. The eyelashes are everted, present, and evenly distributed. Eyebrows are present, symmetrical, coarse, brown, with no lesions or scaliness present. We assess the cranial nerve 2, the optic nerve, with the Snellen eye chart. And then also we assess the cranial nerves 3, the ocular motor, 4, the trochlear, 6, the abducens, with the 6 cardinal fields of gaze that we checked. They're all intact, full, and without nystagmus. We checked your pupils. Pupils are equally round, reactive to light and accommodation. Cranial nerve 3, the ocular motor, also we checked the direct and consensual. With farsightedness, when we check this, the pupils will dilate, and then with nearsightedness, the pupils will constrict as the pen light gets closer. If I had an ophthalmoscope at this point, I would take a look at the eyes to observe the optic disc, the retinal vessels, the fundus, and the macula of the eye. So next we're going to move on to your ears. Take a look at those. Are there any tenderness?
No.
Okay, we're going to look on the inside. Okay. Okay, great. Ears are symmetrical. The skin is uniformly pink. There are no piercings. It's warm without lesions. Elastic with immediate recoil without any tenderness. When we looked in the ear with the pen light, there were no foreign bodies present, and just a small amount of cerumen was noted. I'm going to have you cover one ear for me. There you go. I'm going to whisper a word. I'm going to have you tell me if you hear this.
Rabbit.
Okay, and we'll check the other side.
Carrot.
Okay, great, thank you. The cranial nerve 8, the acoustic nerve, is intact as evidenced by your ability to hear the whispered word when you covered your ear bilaterally. If I had an otoscope at this point, I would inspect the interior of your ear, looking at the eardrum, the tympanic membrane, which should be shiny, translucent, and gray. Next, we're going to look at your nose. Any tenderness to the nose?
Mm-hmm.
Okay. And so can you occlude one side of the nostril and then take a sniff on the other side? Okay. I'm going to have you close your eyes and tell me what you smell.
Okay. Coffee.
Okay, great. So nose is midline on the face. There is no deviations. I'm going to check your sinuses. Any tenderness here?
No.
Great. The frontal and maxillary sinuses have no tenderness. We check the cranial nerve 1, the olfactory nerve, by checking your sense of smell. Okay, we're going to look at your mouth next. Okay, can you say ah? Okay, can you lift your tongue up? And then can you stick your tongue straight out? Great. All right, your lips are symmetrical, red and moist. There's no cracking. The buccal mucosa is uniformly pink, smooth, moist, and without any lesions. Teeth are all present, white and in good repair. There's no appliances present. Your gingiva are pink, slightly stippled with edema, without edema. No retractions, bleeding, or lesions are present. The hard, soft palate are continuous and smooth without lesions. Hard palate is white with transverse rugae. The soft palate is pinker and smoother. Tonsils are absent in this patient. The uvula is midline, rises and falls in the midline with phonation. We would check this at this point the cranial nerve 9, which is the glossopharyngeal, and cranial nerve 10, which is the vagus nerve. The tongue is, the dorsal surface is pink, moist, and roughened from papillae. The ventral surface, smooth, glistening, with veins and saliva present. We check the cranial nerve 12, the hypoglossal, when you stuck your tongue midline. We'll look at your neck next.
Okay.
Okay, so can you turn your head each direction and then extend? And then can you do chin to chest? Okay. Turn your head one more time. Okay. And then straight head for me. I want to fill up all your left nose. Okay, great. So with the neck, his skin is tan. There's coarse hair present. It's symmetrical with full range of motion. There's no audible or palpable crepitus. The patient is able to extend, hyperextend, flex, and rotate. The trapezius and sternocleidomastoid muscles are strong. Your cranial nerve 11, the spinal accessory, is intact as evidenced by your equal and strong movements against resistance. We checked all of the lymph nodes. There were no palpable lymph nodes, which means there's no lymphadenopathy. We checked the occipital, the posterior auricular, the preauricular, the tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and the supraclavicular. Take a look at your carotid arteries next. Just going to feel. Take a listen. Can you hold your breath for me, please? All right. So I had him hold his breath while I listened with the bell of my stethoscope. This is checking for any bruit. Bruits can indicate turbulent blood flow, and in this area can indicate an enlarged thyroid. His carotid pulses are all strong, equal, with regular rhythm, and no breathe. So next we're going to look at your chest. So if you would remove your shirt for me. Okay, we'll start on the back side. Feel your spine. Okay, we'll have you take a real deep breath. Again. Okay, great. No, no. Okay. Okay, and we'll listen to your breath sounds next. Can you take a deep breath for me? Also listen to the front, the anterior side. Take a deep breath. Okay, thank you. So the skin and the chest thorax area is warm and dry. There are no lesions. AP to transverse diameter is 1 to 2. Spine is midline with S shape on their lateral view. There was a resonance noted when I percussed the lungs on the posterior thorax. There's no tenderness noted anywhere. We heard vesicular breath sounds on both on the posterior and anterior thorax. Lung sounds were clear to auscultation bilaterally with no adventitious breath sounds. At this point in my assessment, I would be doing the breast exam. So for a female patient especially, we're going to have them do 3 positions to check for any dimpling or retraction in the breast tissue. So I would have the patient have arms overhead. I would have them sitting with arms at hips, and then also sitting with the palms together. To actually perform the breast exam, I would have the patient lie supine, and whichever side I'm assessing, I would have them raise that arm up overhead. So when you're assessing the breast tissue, you're going to use your first 3 fingers, and there are several different ways to assess it. A couple of those are the vertical strip method or the circular pattern. At the end of that breast exam, after you've thoroughly assessed all of the tissue, you're going to squeeze the nipple just to check for any discharge that might be present. The nipples and the areola should be darker in skin color than the rest of the breast tissue, and also nipples can be inverted or everted. So one finding you may have at this exam would be no axillary nodes palpable, no masses, no tenderness, or nipple discharge. To assess the axillary nodes, I'm going to have the patient lift that arm up overhead, and we would check for the anterior and midline and those posterior nodes. We'll also go up into the arm to kind of feel around for those nodes there. We're all going to assess the mental status of the patient. I want to give you 4 words here in a few minutes. I'm going to see if you can remember those 4 words for me, okay?
Okay.
They are rabbit, couch, truth, and apple. Okay?
All right.
Can you tell me the year?
2017.
Okay. And which state are you located in?
Arkansas.
Who's the current president?
Donald Trump.
All right. Can you tell me your name?
Brian.
All right. What's your profession?
Pilot.
How long have you been doing that?
Over 9 years.
Okay, great. And can you recall those 4 words that I gave to you around here?
Rabbit, couch, truth, and apple.
Great. So ideally you want to wait about 10 minutes before you ask them to recall those 4 unrelated words. This assesses their memory. And that is it for today.
Thank you.